Let's talk to Niall Dickson, who's Chief Executive of the NHS Confederation. Good morning to you.
Good morning.
Good morning. Now, we spoke last week. Things clearly are moving on now. We've seen a big spike in the number of cases over the last couple of days. We now also seen the very first death on British soil, and again from somebody who'd not been travelling to Wuhan or another affected area, but it seems to have had the transmission in this country. Evidence from Chris Whitty, the Chief Medical Officer, yesterday to the Health Select Committee suggested we are on the brink of moving officially to this delay phase. Can you tell us what that actually involves? In terms of, I mean, talk, those words have meaning to us, but what does it actually practically involve for not just healthcare professionals, but the government as well?
Well, I suppose the first point to make is that they sound as if you move from one thing and then you start doing something completely different, whereas it isn't quite like that. You're doing additional things, really. In the contain phase, which we've been in, it's trying to detect any cases that are around, following up their close contacts, trying to prevent the disease, taking hold in this country for as long as possible. When you get to delay, you accept the fact that it is spreading within this country. It's not just people who've come from abroad. And now your job is to try and slow the spread as far as possible. And actually quite a lot of the things you do in contain, you continue to do. But the idea of delay is to try and lower the peak impact and try and sort of push it away from the winter season, because the warm weather helps, because it helps to kill the virus. And so
well, what's I'm saying, can I tackle on that? Because I've constantly seen this online, people saying, well, this is the big hope, because again, flu and colds tend to go down when we get to warmer weather. But we have seen massive outbreaks in places, like Hong Kong. And yes, I was in Singapore, it was 33 degrees. That didn't stop the virus from spreading.
No, of course it doesn't stop the virus from spreading. I think there's also, incidentally, the question of flu is a seasonal, and a lot of the other things that we're having to cope with are seasonal. So the system's already under strain with these infectious diseases. They do tend to not disappear, they tend to go down when you head into the warmer period. So that means that the system, in theory, is under a little less strain than it would otherwise be going forward as well. I'm not a virologist, but as I understand it, there are also advantages just in terms of it, the degree of spread.
Yeah.
And just in answer to your point about, what was delay actually involved? I think, well, first of all, you'll see a lot more. You're beginning to see it, publicity around hand washing. I think we'll hear stuff around social distancing, particularly in relation to vulnerable people. A lot of talk about self-isolation to both prevent the spread, but also to protect the vulnerable. So, again, we're probably a bit away from this. But you could, for example, I think the word is cocoon, places like, an old people's home or something like that, where they have no virus at all, but you sort of protect them by reducing the amount of contact that they have, because the people within there are much more vulnerable than the rest of the population. So there'll be more testing. I mean, we're already ramping up the testing big time. Eventually, you won't bother testing people who are, who are not very ill. They'll just stay at home as if they had it, and they'll self-isolate during that period. But I think at this stage, more testing in the community, and of course there are some drive-ins and all that. And again, it's really trying to protect hospitals and GP surgeries from people going in there when they don't need to go in there, and so forth. Eventually we will see, I'm sure, cancellation of operations, cancellation of routines. And that's the great thing, because the health service is under enormous pressure, but it does have quite an ability to flex. Not an infinite ability, I hate that, but it does have the ability to flex, which means that they can clear out wards, they can reduce the use of currently intensive care, they can expand the number of sort of intensive care beds to provide respiratory support for patients. So there are a whole series of things that I think will go on. And then staff planning is the other thing. You really need to, at a local level, that's what our members are doing now. So they'll be thinking about the recently retired. You've got to be careful about older people anyway involved, medical students, using academics. There's an army of academics who work kind of part-time, and they would be pulled in. I think there are also clinicians working in industry and so on. So it'll be all hands to the pump.
But this is, I mean, and I can understand, obviously, in times of crisis, that obviously we absolutely want that to happen. And yet we've got, 100,000 staff vacancies, not just, doctors, nurses, other skilled clinicians, and all the way down, to hospital boarders and the like. A lot of people will be quite frustrated that we can't seem to sort of get the NHS together and recruiting people in normal times, when we're told we have a sort of 24-hour, 365 NHS winter crisis these days, and yet now they will be able to pull together. I mean, as much as I applaud them for pulling together now, won't there be many people who think, couldn't this have happened already?
I think it's a different kind of thing, isn't it? It's saying to people, this will be for a very short period.
In a crisis.
Very short, but
not long term. Okay, that makes sense.
Up to 9 weeks or so on. You couldn't sustain this. And let's be honest, people like me are asked questions about, will it all collapse and so forth. And the message has to be a reassuring one. On the other hand, of course, if this thing went much worse than we think it's going to work, then you can imagine the health service at some point, no health system in the world will cope with everybody being ill, every member of staff not able to cope, and so on. So we have to plan for what we think is a reasonable worst case. And under a reasonable worst case, I think the advice from the virologists and the clinicians and so forth is, we'll cope. I mean, it'll be very difficult, and it will require an awful lot of change in the way that the service works.
Yeah, indeed. And again, it's going to be a lot of change in terms of who's in beds in hospital. And it's going to have a big effect on social care as well, isn't it? Because something like 60% of people in hospital are elderly people with lots of chronic, many different conditions. And there are now big attempts to try and remove some of those people, as you say, the horrible phrase, bed blockers. But often, there simply is nowhere else for them to go, to get them out where they perhaps don't need critical care, even hospital care. They just need round-the-clock care, move them into care homes, get them out of their beds so that they could be freed for coronavirus patients. This is going to involve a level of joined-up thinking for which, let's be honest, government isn't normally very good at.
Well, ultimately, it's not government. I don't think government...
But when it involves social care as well, it is, isn't it?
Well, no, it was local government and local health services organising themselves in order to be able to do this. I think some resource. I mean, social care is very, very stretched at the moment. So we're certainly hoping that the government will step in and provide local authorities with additional help in order to be able to organise social care and to try and get the resources in there. Getting the people, as you say, is an issue. I mean, I heard yesterday just about a problem I don't think anybody had thought of, which is that there are actually some people in London who are being looked after by carers who live with them, sort of for a period during the week kind of thing, and then they fly elsewhere in the UK or even to other parts of Europe, because the cost of staying in London is so high that the affordable way is to take a cheap flight and come in. And again, that kind of resource, we need to keep it protected. In social care in London, about 50% of those who are involved in social care in London are actually European people from other parts of Europe. And again, keeping that army and supporting it during this difficult time is going to be really important. And important too that the way in which they look after older people will be different as well. So less physical contact and so forth.